What is it going to take to end the strikes? Are you willing to negotiate? Is there anything you would compromise on?
Oh, definitely. We've been working with the government, or trying to work with the government, for the last 12 months. Unfortunately, while we're talking about award modernisation and we're talking about increases above 2.5%, which the restrictive wages policy doesn't allow, the government just hasn't come back to us. The talk is there. They support all health workers through a pandemic, that we're all in it together, but some are in it together a little bit more than others.
One of the main problems that you have is with that cap on wage rises of 2.5%, as you mentioned. The federal budget expects inflation to hit around 4.25% nationally this financial year before edging down. Would it make the most sense to either have a temporary lifting of the cap or even pegging it to inflation permanently?
No, look, it's got to be changed dramatically. Like the wages policy came in over 20 years ago. It's not fit for purpose now. Many qualifications that people have, particularly paramedics and allied health professionals, aren't even realised in the current awards. Over the past 2 years, we saw a 0.3% wage increase and a 2.4% increase. Now, that 0.3% wage increase for cleaners meant $149 a year before tax. So effectively about $1.70 a week. So it's outrageous. It doesn't fit the purpose of where we're at, and it has to change.
The state government says it is continuing to work with unions on the matter. What sort of discussions have you had so far with government?
Well, I'm not too sure what the definition of a union is to the government, because it's certainly not working with us. And from other unions I've seen, there doesn't seem to be too much activity there either. So I think this government's got to put ideology behind them, work out that unions and their communities are really important, and they work with their community, their members, to be able to sustain and build the economy as well as our members' interests. So I think at this point in time, while the government's putting out a lot of rhetoric, there's not a lot of activity between us and them.
There might be some people watching concerned about the impacts of Thursday's strike on the healthcare system. Will ambulances be operating during Thursday's planned strike?
The ambulance paramedics will be having a stop work between 7 and 8. Emergency cases will be responded to. But can I tell you this? You will see a faster response time. We've seen, due to the under-resourcing of ambulance over many years, that the general response times are reasonably slow. So now that we're taking stop work activity, you'll actually see, ironically, a faster response time to emergency cases.
You've said that the hospital system is overwhelmed right now, particularly off the back of COVID-19. Are you finding instances where people are not going to hospital even though they should be because they're worried about the level of care that they would get at hospitals?
Look, there's no doubt that the hospital system is under stress, but the last year of the pandemic has shown the under-resourcing of health across the board has delivered what was a just-in-time service to a service that is failing. Now, everyone's doing the best with what they have, but what they have is not enough. And if we don't learn that out of the pandemic, we'll relive this going forward. But we're also seeing that many paramedics and other workers leaving the state after they've been trained by the state because there's better opportunities in Queensland or Victoria.
Have you at all had discussions with the New South Wales opposition about this?
Not at this point in time, but we intend to be talking with them either this afternoon or tomorrow, because at the end of the day, this is a bipartisan issue in my view, that we need to remove the wages policy. We need to be able to do work value cases, and we certainly don't need to see CPI at 4.5% and wages increasing by 1.5%. I would have thought from a government perspective that basic economics doesn't make a lot of sense.
The New South Wales Premier Dominic Perrottet is back from paternity leave today. He's currently up in the Northern Rivers region in flood-affected areas. Have you got a message for him? Would you be willing to speak to him at any time of the day to discuss?
I would speak with the Premier or any other relevant person 24 hours a day. This is an important issue for not only our members but the communities that they serve. And we need to make sure that we have a wages system that's fit for purpose in 2022 not 1972. An example being we still have incinerator allowances in our awards which haven't existed for over nearly 30 years.